Tātou katoa nei mai whakatau mai ki te puna kōrero o tēnei ahi. It's my privilege to welcome an outstanding panel of wahine toa this afternoon. Maxine Ketu from Ngāti Hāua Iwi Trust, ki Taumarunui, Erana Severne from the WISE Group, and Janise Eketone from Waikato District Health Board. So just to welcome you into our space, and it's great to have you participate in our Puna Koorero session, koutou, panelists, but also those that are listening. So if you have any pātai during our session, please put it into our notes and we'll try our best to respond to those questions that you have. Hoi anō, enough from me. I'm really keen to hear from our panelist speakers, and probably how we'll start off with is we'll just have a quick round of whakawhanaungatanga and then we'll go from there. So hoi anō, ka tīmatau I a koe, e te whanaunga, Maxine.
Tēnā koe rongo, tēnā koutou katoa, I te whānau whānui out there. He uri au o Ngāti Uakaha no Waitomo, Ngāti Maniapoto. He honona Ngāti Hāua au, Ngāti Hāua kia hau. Nō reira, he pauarahi o Ngāti Hāua Iwi Trust. Tēnā rā koutou.
Erana.
Tēnā tātou e te whānau, he mihi aroha kia koutou ngā wahine me ngā tāne huki, nō reira tēnā tātou katoa. Ko waiau, ai te taha tōku pāpā, ko tūwhare tō te iwi, I te taha tōku māma, ko ngāpuhi te iwi, I te taha tōku pāpā ata whai, ko Ngāti Maniapoto te iwi, engari kei kirikiri roa hau e noho ana. He kaiwhakahaere mō te kaupapa here to help you, ko Erana Severne tōku ingoa. Kia ora.
Tēnā koe, Janise.
Ai, tēnā koutou. Ko Janise Eketone tōku ingoa, e mahi ana I raro te maru o Waikato District Health Board. No, ko Ngāti Uakaha tōku hapu, ai, I te taha o tōku māma, no ahireiria ia he tangata moe ia. Ai, tēnā koutou.
Tēnā rā wātu koutou. Hoi anō. I'm going to actually give the kōrero over to you, Janise, and just around an update around what's happening with Omicron. And I know there's heaps of information that's been coming through papers, through a lot of sources, but it's really, really good to hear from the source and the operation side of the mahi that has been undertaken. So,
Kia ora, I suppose, first off, thank you to Trust Waikato for facilitating this, and yourself, Rongo and Dennis. We're anxiously awaiting the Prime Minister's announcement this afternoon and understanding when we'll move into phase 3. We as a District Health Board haven't been advised. We just know that there's that's happening, and we've got a briefing with Ashley at 6:30. All kaupapa providers and social services possibly may have received that invite. If you haven't, I'm happy to share it. The more people who know about it, the better. Then we don't have to regurgitate the same kōrero and everybody's in the know. We find that communications, effective and timely communications, are key in trying to deal with the spread of Omicron. So sharing is caring. You can see on the daily dashboard that comes out from the District Health Board that it's reached into lots and lots of communities. That it is, there probably aren't any communities that aren't affected. In my own family, we've got whānau isolating, we've got a positive case, and it's likely to be the reality for lots of whānau. Did you have any pātai? I just like that's what's right ahead of us in the next 24 hours is transition and final preparations for phase 3.
Yes, so probably one of the key areas that we're going to be leading into with the conversation is how what type of support or what type of coordination can the groups that are listening at the moment, how they can support, where do they fit in, and in particular the coordinated approach that a lot of providers are now doing. So, which leads me to the work that you're doing, Erana. So here to help you, please share with us what here to help you and what the kaupapa is, and probably giving a perspective on a provider perspective, like a community provider perspective, also around an individual person and how they can be supported, and then looking at how they can come into to your pātaka, which is here to help you and to support the people out in our region too. So kai a koe, Erana.
Oh, kia ora. So essentially, for those who may not know what Here to Help You is, Here to Help You is a tool and a portal that allows, I guess, a triage process to happen for whānau, and then we start to look at who are the appropriate providers for that whānau to be able to deliver that service. We initially were set up in the first COVID lockdown, and now our mahi has grown and expanded. So what we're starting to see now is trends across the self-isolation space, where we're seeing almost a doubling every 4 to 5 days, and that's happening across the board. The things that we're finding from a whānau perspective coming through for people who are self-isolating are needs initially in the kai space, and then it flows on to cleaning products, hygiene, and some of those basic things. And there's some more complex things from there. What we are finding sometimes, in the change process is that our whānau can be waiting periods of time, and there is some miscommunication, I think, working in different spaces. So some of our whānau are finding it complex sometimes to understand the self-isolation rules, my whānau included. Like Janise also had a whānau member who tested positive yesterday. And I think with the changing rules and the changing stages, it is confusing for our whānau about what they can do and what they can't. And there is a sense of anxiety and fear about what rules to follow and what not. So that's kind of what we're seeing. We're also seeing trends and weird things pop up as numbers increase. Things like washing, where our whānau were going to laundromats before, but in isolation that's not possible. So we are seeing things pop up like that. That's a little bit different. Initially, we were seeing the trend really strongly in the kirikiriroa space, but obviously, as Janise mentioned, it's touching pretty much most parts around the Waikato at the moment. So that's essentially from that perspective. We are seeing from provider perspective as well, is that, because Omicron is getting out of there, it is sometimes affecting workforce. So essentially, sometimes we don't always have the capacity from a provider perspective if somebody goes down. So that sense of bubbles and when one provider goes down, it can put pressure on others and things like that. But what I would say is that we are very lucky. We have people who care about the community, who are doing an incredible job on the ground to deliver to whānau. So just an acknowledgement there of the incredible mahi that has gone on in that space. From people really doing it and really caring and going out of their way, especially our providers, our Māori providers, Pacific providers, who are working 7 days a week, and also our providers on the ground who it isn't their BAU service to be serving self-isolation, but they are doing that, and numbers are increasing for them. So actually, there is a strain on those things as well. So some of the things that Here to Help You is looking to do, I'm very clear about with Here to Help You that we do a couple of things really well. So we do the triage process really well, and we create a consistency with that, but we never dabble in the service provision space. So we do a couple of things really well. So some of the things I'm looking to do is when we have discretionary money, we can turn it straight into products to deliver out to whānau. So there's some things we can do like that to help support in tangible ways to providers.
Okay. So in terms of if I was to register online to Here to Help You, so I'll give you a scenario, and in my whānau, I have 10 people living in my whare, and we only have 3 rooms and 1 bathroom, and with all different multiple, some with some really high priority health issues. So when I register with Here to Help You, what happens there? And then I will put down all my information.
Yeah.
And then what happens with my information?
Yeah, so the advantage of that is that, so Here to Help You has two-factor authentication. So it means that people coming into the portal, it's really safe, and it also has penetration testing. So when a whānau comes through, what we've tried to do at every point of the triage is your information is only shared with the provider that's going to pick that up. It's not shared with everybody. And also, when whānau come in, there's multiple ways they can come in. So they can either self-refer themselves on the website, use the free 0800 number, or they're being referred by providers like DHB and MSD through the portal to go out. So the great part about it is that whānau don't have to do a big lot of information at the start. They can say, this is who I am and this is what I need and this is how to contact me. And that's the job of the connector, to do a solid triage process. And so essentially when that process does happen, we ask things that you wouldn't even think about, like safe delivery instructions. Actually, when you do have your kai, is there any dietary requirements? We are looking at the total whānau members, and we know in our beautiful Pacifica, Māori and migrant whānaus, they can sometimes be very large, up to 21, sometimes 23 in a household. So we'd look at the complexities, but we also know there's a range of providers that do different stuff, and it's about sharing the load across that system. So with Here to Help You, there's always the preference first. Do you want a Māori provider? Do you want a Pacific provider? Do you want a faith-based service? It is the whānau's choice first about where they go in terms of their service provision. But the other part of that is also looking at actually how do we spread that load. So if we have some complexities with a whānau where they're needing extra support, they may be better to go with a Māori provider who can do, or a Pacific provider, whoever's appropriate, to do the full wraparound care for that whānau. Whereas there are some providers in the community who might just deliver the support. I had a case like that personally. I've been on the ground myself as numbers have been increasing. And so I had a case the other day where we had a worker in a health setting who was good to go, but they just needed light touch work. Actually, they just got called out and they needed a food parcel, but they didn't need the full wraparound care. So actually, we can distribute out to providers who will do that work, rather than sending them to a provider where maybe they have the capacity to do the full wraparound care for complex cases.
Fantastic. So my family, we actually live in Taumarunui.
Yeah, beautiful.
So how do I connect with Maxine? How do I connect with you, Maxine? Can I go through to Here to Help You? Can I all go directly to you? And just, yeah, sharing with us around the support that you're providing. And it's quite unique, I have to say. There's a partnership that is really, really quite transformational, I have to say, but I'll let Maxine share that. So kei a koe awa, yeah.
Oh, kia ora. I'll get your question last, perhaps, if that's okay. So I just wanted to say thank you, first of all, Rongo and Dennis, for this opportunity. It's a new experience for us here at Ngāti Hāua in Taumarunui, and we just appreciate the opportunity. I'd also like to say thank you to the DHB through Janise for being brave enough to be a true partner with iwi in this mix. I'm sure it's challenged many norms for many people, and awakened some whakaaro across the spectrum in terms of that true partnership relationship between iwi and the Crown, and in this case through the DHB. I also have to acknowledge our whanaunga, our very close whanaunga, and as you said, we are a unique experience down here with close whanaunga of Tūwhare tō Maniapoto, working with us as mana whenua Ngāti Hāua, coming together to protect our rohe of Taumarunui and our surrounding areas. For those that don't know, here in Taumarunui, we're the furthest south for the Waikato, the furthest north for the Whanganui, the furthest east for the Bays DHB, and the furthest west for our Taranaki whānau. So we're bang smack in the middle, and our whakapapa is unique, where we have always traditionally come together to protect ourselves and protect our rohe. And COVID has definitely reignited that customary practice. And as a result, we've been working together to do everything we possibly can to keep our rohe safe. And whereby in the last experience last year, where many of our whānau were being turned away for seeking help, we just made the decision as a whole community involving all our hapu and marae to come together under Te Whare Taumarutanga, which we launched in November for the sole purpose of coordinating with the DHB and Ministry of Health anything that comes into our rohe as an iwi partner. And from there to ensure there's no duplication, that everybody who lives in our rohe is given manaki, and right from the beginning of their journey to the end, which included coordination of service providers, welfare, testing, vaccination, whatever the need was. And as iwi, we're available 24/7. I have a lot of makeup on under my eyes at the moment. Like that.
So in terms
so we've come about based on our experience and our whakapapa. Our why is our need to protect our isolated rohe, and our drive is that ongoing protection, our vulnerable whānau, our koe and our kaumātua who aren't plentiful in numbers, and our tamariki and mokopuna. Yeah. So and how do you connect with us?
Yeah.
Yes. Yeah. So in a perfect world, you would connect with us through the PHU and GPs. And we get notified straight away because we're, as I said, we're a true partner. We're there. We've positioned ourselves so we're right there. Unfortunately, this latest outbreak has created some potholes in the process. So now there are other ways of, there are other challenges that we're experiencing to make sure that you're connected, to make sure that that you at least have been contacted and that you at least know that you're not on your own. And because we currently do mobile vaccination, community-based assessments, we provide the wraparound, we're connected to our community, including our local providers. In the mix, we're getting that information. Sometimes it's a little bit delayed, you know, sometimes it comes in behind, but we're slowly getting a handle on the current blowout, if I can say that, of cases, but also the fear that that's created, and then everybody's coming in saying I'm a close contact and, you know, stuff like that. So to be honest, through iwi contacts, we do not go down any normal channel. We've got our own, and they're alive and well, our kumara vine, and they have a huge reach. So yeah, that might sound a bit confusing, but it isn't. It would have been an easy fix when we had our small numbers, but now that it's gone bigger, and there are other channels and all the systems are under pressure, we're having to modify everything and challenge everything and just make sure we're at that point of contact when that information comes through.
Fantastic, Maxine. I'm already in Tauma, your whare now. Oh, cool. And just in terms of the engagement that you've had with the wider community and the collaboration, you know, how has that been working out for you? I know you've mentioned it in your kōrero, but, you know, what does that look like? And, you know, when I come to you and, or maybe you might not be able to support me, but where am I going to go to? And are you going to be with me, or, yeah, how does that work?
So we walk beside you in a variety of ways, for sure. So through our hub, Te Whare Taumarutanga, and our case coordination team led by Piki Tairo, she is the constant, and her team is the constant in terms of that contact with whānau that come through as either a positive case or a close plus case, but we also support those who feel they are and feel they've come into contact, just to, and I love the phrase that's been penned, calm the farm, because it's a time of anxiety where whānau, for example, will come into the testing station and they feel that they're a contact because they heard, because I heard this and I heard that, so, you know, I was there, so I must be a close contact as well, and I think I'm positive. So, you know, just really doing a range of things to settle everybody, even and where we've just offered a real basic kai pack, you know, kia tau, and then go home, you'll be contacted, and then we'll support you from there to make sure there's absolutely no reason for you to leave home while we work through this process together. It's been working really effectively, and like I think Erana has said, in that mix, these are the supports that are available to you in the community. You're free to choose whatever you would like, but we are going to continue to walk beside you while you're receiving that tautoko, whatever it looks like, to make sure, one, you are, and two, that it's constant right to the end of your journey. And so far, so good. The numbers, you know, I think we've just hit double figures. I think we just hit 9 for 10, sorry. So, you know, when you compare that to the bigger centres, obviously it isn't a comparison, but I firmly believe part of the reason for our low numbers is that tight coordination through that hub process.
Fantastic. Oh,
yeah.
Tēnā koe. So Erana, is there anything that you'd like to add to the conversation around how you're linking in particular with some of there are some other hubs that are established, but in terms of working alongside Maxine and here to help you, what does your relationship look like together?
Yeah, rawe. I mean, well, I'm actually in Raukawa at the moment, and Raukawa's building their office in one of the hubs itself. So, yeah, that kind of gives an example. So we, at the moment, we're at different levels of conversation because hubs are at different levels of operation. So an example of one of the ones that we are doing here is a partnership with Raukawa. So they actually have their own connectors who are using the Here to Help You portal to distribute out to Pacific providers and or other people that can serve in self-isolation, and they have their own hub here. So I was literally here training 2 more of their people today, and that I believe is also true partnership because it's sitting alongside of and we're working together and we're using our smart triage and the things that we're learning in the triage process and helping walking them through and sharing our resources and working together in a really tangible way. So that's where I am currently, and I think what's beautiful is that in what we have seen in Tokoroa as a whole, we have seen numbers increase here, and they are coming also from hospital, coming from different places and self-referrals, and I think that's really important. We need our traditional systems, we need DHB and MSD to send through those channels, PHU, but actually we also need to give whānau option to refer themselves, because the reality is as the system increases, local knowledge, exactly what Maxine was saying, local knowledge is integral. You know, we had Whaia Akarere saying, hey, I heard there's 8 Pacifica families that are close contacts. Only local people know that stuff. So it is, I think, a beautiful partnership down here in Raukawa where they have their own local people in the system, but they are supported by our team as well. So actually, if you get overloaded, we can top you up in support, but we can also share our learnings across the board. So there's a consistent triage across the Waikato area. What we've found at different hubs as well is that some people are at different stages. So what we've said is we've almost done like a phase 1 and a phase 2. So a phase 1 is my team will come in and do your triage to start with while you're setting up your hubs, and at least the support can still be done in your rohe. Then phase 2 is essentially we actually bring your people in with us in true partnership, and it's similar to Raukawa where they can actually use the Here to Help You system to distribute out. So the cool part about that is we can start to see trends across the board and we can advocate. So when I see the trends going, actually You know, we're seeing really big numbers of our whānau needing hygiene packs, sanitary, cleaning products. Well, I'll use my funding that I have and turn it straight into products for providers and get it out. Because what we have learned is money doesn't always solve the problem. Actually, sometimes there's logistics and supply chain and things like that. So we can do tangible stuff like that. And in terms of our partnership as well, Here to Help You is free for whānau, and it's also free for providers. So there's no charge. We just work together, and it comes from a beautiful place. So we're currently operating in a couple of places within Waikato. So we haven't got down to Maxine yet, but I saw she was on the Koorero, so I emailed her. I was like, kia ora kare, I'm from Koorero. So tūwhareto. So I'm sure we'll enter in a conversation, but a big thing about Here to Help You is we never force our kaupapa on anyone. It's there for people and whānau who want it, and if people want to partner and work together, choice, you know, but there's no pressure to do that. But what I can say is, you know, when we're in places like Raukawa where, you know, yesterday they had 15 referrals here, actually they're really grateful there's that system in place. As numbers increase to be able to distribute out, there's a sense of calm there because there's a support system and working together, similar to what Maxine had said. And what our providers have said on the ground as well is when Here to Help You does the triage, we are reducing some of the double up information that's happening across that system, because some of our whānau are having to answer questions to multiple different groups all the time, and that can get quite exhausting, especially if you've been promised something and it hasn't been delivered. So if we can even reduce one of those, that would be amazing. An example of that on the ground as well is Whaiarangi Mohora, who's one of the incredible connectors delivering services 7 days a week from Awa Awa Kaumatua Charitable Trust. When it was coming through to her, referrals come through from many different people, and it comes through with wrong address sometime, wrong name, you know, whatever. And so she was having to do another triage, and it would take a longer period of time. So one thing I said to her was, Whaia, give me your triage notes. I will implement it within our triage. Then you can pick it up straight away, and you've got the information at your fingertips. We don't have to wait for the whānau to respond to that. So we did that, and we were able to decrease the delivery time because she could just call and say, kia ora, it's Whaiarangi Mohora, and she's got everything she needs. So that's a tangible way of how we can decrease delivery times and increase efficiency for providers.
Fantastic. And just in terms of, it has been mentioned through our Koorero, just around hubs. So Janise, there's been some hubs established, in particular for COVID and triage mahi. Can you share with us about what that looks like, and in particular across our whole region?
Apai. At the moment, Te Whare Taumarutanga, Maxine's and the team's hub in Taumarunui is one of 11 hubs that are standing up. They're fully operational. As Erana mentioned, others are in different stages of standing up. What we've done at the District Health Board is trained hub members or hub staff to do public health functions. So case management, case coordination through the National Contact Tracing System, and working in partnership with the general practice practitioners in their area, coordinating care and support for whānau that are isolating. All of the hubs are, or most of the hubs, the lion's share of the hubs are all Māori, iwi Māori or Pacific led. The only hub that isn't is the one that's being stood up for the Waikato ethnic communities, and that's going to be led by the Hamilton Settlement Centre in Hamilton on Boundary Road, but all the rest are iwi Māori or Pacific led. It's important to note that these are collaborations of local community providers, iwi Māori, everybody who's in the COVID isolation, in the COVID response space, and they're particularly designed to support those who are clinically high risk or vulnerable in the community. So if we've pre-triaged the whole population, so there's about 450,000 people who live in the Waikato District Health Board region, and we've pre-triaged the whole population, and we know that there's about 70% of the population that will be relatively okay with dealing with their isolation and COVID, but there's another 20-25% that will need a light touch. So the 70% self-managed, get a text, link into the app, do their own contact tracing, that kind of stuff, and manage their cares themselves. They can do that. Then there's about 20-25% that we think will need a light touch, a bit of support, and then they're on their way. And then there's 5% that the hubs and the District Health Board are particularly focused on to ensure that they are safe in their isolation, have their clinical and their welfare supports in place, because they have comorbidities, they've got complex living arrangements, or as it were, they're not so complex if they're Māori or Pacific, because we have large families. And so the disease starts to move through the whole household, and you've got 15 that are positives and 10 that aren't, and then all those kind of nuances. So the hubs are focused on supporting the 5% in the first instance. The District Health Board, once we have finished training members of all the hubs, then allocate across to the hubs, and the coordination starts there. So we're actually building a bigger network and bigger capacity into the communities, so communities are able to support themselves. I mean, there's nothing to say that once we get to the peak of this, that what I'm trying to put across is, if the District Health Board and the Public Health Unit are the only ones who are supporting this, it's not enough. There's never going to be enough DHB or enough Public Health Unit to support this response. So moving, trusting, growing capacity and capability in the communities is the way to go. And local intelligence, as Maxine and Erana have mentioned, has been a real key in containing the Delta spread. So it's been magical, really. Like our uplines in terms of the ministry are just trying to understand how we did it, and we had local responses, local intelligent community leaders, iwi champions, whānau champions involved in case coordination and management, rather than our staff, who are all very capable, but they don't know the communities so well, especially when you're reaching into Taumarunui, Taharoa, you know, down to past Mangakino, which we're not supposed to be, but sometimes we go down there. Yeah, so enriching, enabling communities to do what they know best, and having total line of sight of everything that we know, DHB knows about these cases. The community will have a team in the hub who know the same, who knows that too. We've also experienced, especially with Omicron, that the national system doesn't know everything on time. So we have whānau who are actually isolating positives already, and it's not through the system yet because we've got blockages with results and testing and those kind of things. So yeah, having the supports for those families in place. I take my hat off to Taumarunui and Te Raukawa. Taumaranui's been planning for near on 12 to 16 weeks for this, a whole of community response, the clinicians, the hospital, St. John's, the ambulance, the everybody's have been around the table having conversations about putting things in place and preparing a response. And it's the same that's been happening in Raukawa and other communities. I've put in the chat the link, the free phone number for the Waikato DHB COVID Integrated Coordination Centre. So if you have partai about a case or something like that, and you don't have, you haven't already been linked to a hub, you can go there and they can help with your queries, and that includes for whānau, and linking whānau to better information. That goes to from 8 to 8, starting on Monday. It's 8 till 6 at the moment. Those phones are always manned 7 days a week. So ka pai. We aren't at the moment giving out hub contact details, mainly because we're trying to filter everybody into the Integrated Coordination Centre. The hubs we're just a bit nervous about being overrun.
Yes.
So it's up to the hubs if they want to share their details with the local community. But if you don't know who they are already or haven't been contacted, have a think about who the leadership is in your community, and they'll be the ones who are running it. Did you have any pārtai?
She's awesome, Janise, because one of the key things that you've shared with a lot of people who are listening, they're actually, the roles that they play in their communities is quite key and quite significant. So, you know, just for those that are listening, if you don't know who the local hub is that is in your community, well, I probably expect that you would, but yeah, it's yeah. So your efforts as well are going to be contributing to the work of everyone that's listening this afternoon. Maxine.
Yeah, and I would like to say the 2020 experience, the initial COVID-19 outbreak, that helped bring down barriers and transgress barriers that were up between community groups, individual groups, iwi and local providers and organisations, and so that was a really valuable learning. So, you know, when, like Janise said, we've been planning for this for 16 odd weeks, but the genesis started in 2020, and it was, you know, for us here at Ngāti Hāua, we're just a little trust going about our business, but the focus has been treaty settlement. Then COVID steps in, and next thing I'm knocking on people's doors. Hey, what are you doing about this? How can I help you? No, you need to think about it like this. And so there's been a real change. So with those barriers coming down, that's meant that there's been a change in vocabulary and the way a conversation takes shape, which has been a bit of a learning for our community across the board. And, you know, often with change, you ruffle feathers, and I've ruffled feathers, but with an aroha intent, you know, and so yeah, intentions are good.
Tēnā koe, Maxine, thank you for sharing that. So we do have a question, and it's from Dennis Turton. And the question is there access to rats tests to whānau if they have to isolate, and how do they access these?
Oh, can I put it in the chat? I'll put the answer in the chat. I've just gone back to our testing lead, only because things are changing quite quickly around access. Like you would have heard yesterday, the Prime Minister make announcements about pharmacy and GPs. They didn't even know that those announcements were coming. So I'll just triple check what the right response is, and then I will put it in the chat, or you give it to you and you can share it to all of those that have been listening, because I don't want to provide advice that's 2 hours old.
Yes. Kia ora for that. Yes, because they are, yes, it is ever changing.
Things are moving so rapidly. But, you know, it's, yeah, I'll just wait for that to come through. It's coming.
And we also have feedback from Annette. Kia ora, Annette, and she's from endometritis. So kia ora, we had feedback from our community that they don't have data on their devices to access some of the websites, including our own. Just wondering if anyone knows if there is a facility for them to access free, low-cost data to get websites set up to be data-free. Oh, that's quite a big question. Yeah, yeah, around comm stuff.
Erana, have you seen anything in here to help you?
Yeah. So, I mean, there is one way they can, with Here to Help You, they can call the free 0800 numbers. So in a lot of the services, they can use the free 0800 number, and Here to Help You does have one, and they will get access in the same way. So that is one way in which they can do it. There are sites that have been paid for, I believe, either by MSD or by MOH, where they can make it data free. And that is something that Here to Help You wants to be. So no matter if you have data or not, you can use it, and there will be no charge to the individual. So that is something that we want to work towards. So I'm putting it out to the universe right now. But that is something we want to work towards as well. The other advantage is that if you are engaging or you're seeing a whānau, and we do have whānau who don't have access to a device at all, in which case with Here to Help You as a whole, they can actually be referred by the provider. We've got a full referrer pathway where they can do that. So there are different ways in which a whānau can access either if they, because the digital divide is broken into multiple ways. One is the ability to know how to use it, one is the access to the data, and then one is the access to the device. So there are a multitude of ways in terms of that digital divide. In terms of the data itself, that's something that we want to work on, but there are 0800 numbers for whānau that they can use as well.
Excellent. Cool. Now, is there any questions coming from from our participants? Anyone have any part-time? Probably one of the key things I'd like to, from each of you is around what's the most crucial piece of information you want to share with everyone this afternoon, and they can relay it to the communities they serve as well. Is there something that you'd like to share with them before we close our session? And I'm not going to, you decide who's going to answer that question. Kaya koutou. Maxine.
I suppose the one key thing for us is if it's not serving the people, don't accept the response and don't stop. Keep pushing and challenging.
Okay. Erana.
Kia ora. I think one of the things that I would like to highlight is we are about to go into a peak, and this will happen, and that's going to happen for several weeks. And I really think it's important that we look at the well-being of both our individual staff and teams and how we maintain that well-being in this crisis peak, because it is. And how we also keep in the back of our minds the well-being and support of our providers on the ground, but also, with, those in MSD and DHB as well. Actually, people are working really hard. And so, how do we maintain the well-being of our people while we do that? But my second piece that I would say and acknowledge is that for all organisations, you need to start pivoting away from BAU strategies if you're not already, and start moving towards a different strategy now. What I have found is the people that find it very difficult are the ones who have pivoted from BAU to crisis too late. So I would encourage that if you haven't moved or pivoted now, you should do it now. Yeah. So prime example in my own org is I don't care about your financial strategies. I don't care about all your BAU stuff. Drop it. It is service delivery, people first right now. And unless it fits within serving people first and the well-being of our team, it's out for the next 8 weeks at minimum. So that would be something that I would encourage.
Tēnā koe. Thank you. Janise.
Oh, tautoko that. So we have, amongst our teams that are in the COVID response, are staff that have been totally redeployed from across the whole organisation to focus and turn into the face of and face the wind of COVID. So they are, and then as the numbers increase and we have more coming into the hospital, we'll also have to redeploy into there to support, to create more capacity. So yes, definitely tautoko that. I think everybody who's on this live are community focused, people dedicated to making a difference in what they're doing, and I want to say thank you. That's probably where I'm at, is the thank you, the gratitude, the acknowledgement of all the hard work. Everybody's putting their shoulder to the grindstone, and it's going to take a mammoth effort over the next 4 weeks. We hear that peak is coming in the next 3 weeks. If you're deciding to pivot and to redeploy, look to support your hubs. And look to, obviously you're probably already with Here to Help You, but even think about if you don't have like goods to be able to provide, maybe there are services within your organisation that you'd want to put onto Here to Help You, mental health support, even the delivery being another delivery organisation who can move something from A to B for a family that's in isolation. That's really important. And weekend, like from Saturday and Sunday, are quite difficult times for people who are in isolation to be able to get things that they perhaps need. And so I'm just putting it out there. Thank you. And yeah, we're all in it together. Kia ora.
We certainly are. I took all of that we're all in it together. We just have a question from Cindy Pack, who's involved in the Asian network, and she's wondering where she can get support for migrant families here in New Zealand that don't have families here in New Zealand to support them.
Yep.
So
that'll be through the settlement centre. So they're directly involved in, as you know, relocation and support for migrant whānau who are coming into the country, and they've settled here over time. So they also have a well-established language network. So all the different languages, they've put together a support team, and we use them quite a bit in the hospitals for whānau who come into hospital and English isn't their first language. So all the interpreter services. So I would point you towards the settlement centre. They will be the hub for the Waikato ethnic community. So not just for Hamilton, for everybody that has resettled over the whole of the Waikato area, down to Taumarunui, up to Hauraki, across to Koorero and the coasts.
Rawi, and just to layer on top of that, there's also Shama, who have a community connector, and they support ethnic families within the kirikiriroa space as well. But to layer upon that, I think that, as it is just as important to have Māori and Pacifica staff that represent our whānau that are coming through, it's also really important to think about our Asian and migrant whānau as well. And, we just actually hired a beautiful Filipino wahine who speaks Filipino and Korean. So on top of having those beautiful services there to do that, actually our workforce should also reflect our communities and ensure that we're thinking about that when we hire as well. So just to layer on top of that.
Hi, and I tautoko what you're saying there, because it's always really, really awesome to go to a service and you see the same face, your relations basically. So yeah.
And for us here in Taumarunui, if you've made our rohe your home, you're part of our iwi, contact us.
Fantastic. Well, I'm sorry, I'm just trying to keep up with some of the questions, but there's nothing there. It's just been a pleasure to hear from you, and just to reiterate to the three of you, our panelists, but also the people that are listening, kei runga noa tu koutou, katoa, kawaneke. So you're doing some amazing work. I know that it's to the point of exhaustion, and I know that a lot of people have been suffering from fatigue, but we're going to get there. And like Janise was sharing with us all, we have to do this together. It has to be a coordinated approach, and to ensure that we get the collective impact that we want to achieve out in our communities, which is to support those vulnerable families that are going through this trying and challenging time. And there's more opportunities also to come together and to support each other in this big, massive work that we're going to be entering into the next phase of next 6 weeks, basically. And then no doubt something else will come after that when we enter into winter. But we'll get ourselves through as a community through this next phase of Omicron. We don't have any more questions. I don't really have any other than, keep up the amazing work and keeping our people safe. But is there anything else you'd want to share with us before we close? Just any closing comments? No? And there seems to be no questions coming through. Hoi anō, I think that we're going to be closing off our session 5 minutes early. I'm keen to find out what this announcement is that happened at 12, but I thank you for the link, Janise, and sending it through to us. Keep well. Maxine, Erana, Janise, thank you for your precious time. And everyone listening as well, thank you for your precious time. And there is some a lot of things that we need to still consider moving forward. So if we don't have anything more to share, I'm going to actually close our session. And keep well, everybody, keep safe, and keep informed. And mā te wā. Mā te wā meaning we're going to be connecting again. So nō reira, tēnā koutou katoa, ngā mihi, hei kona.